Cancer can be the source of a great deal of stress among patients and their loved ones. Stress that Assemblymember Henry Perea believes does not need to be compounded with their inability to choose and pay for the medicine they need. Assemblymember Perea's legislation, AB 1000, would help ensure that cancer patients are not denied the most appropriate and effective treatment simply because it's administered orally rather than intravenously. AB 1000 will require that oral cancer therapies be covered on the same basis as the IV therapies.
It's critical, and I saw this experience firsthand when my mother, who is currently going through her fight with cancer, what the cost disparity is between oral form of chemotherapy and intravenous.
Currently, IV anti-cancer medications are a part of a medical plan benefit, and patients are only responsible for an office copayment. For oral anti-cancer treatments, patients are covered under a pharmacy plan where their out-of-pocket costs for a $3,000 per month oral medication can be up to $900.
The industry will say that this will increase costs, but however, I think it's important to note, according to an independent review of this bill, that the per month, per member cost increase of this will be a penny to 3 cents a month.
And I'm living more of a regular life than someone who is tied to going to the doctor appointments.
Jerry Carpentier is a cancer patient who testified in favor of AB 1000.
Who's deciding that I can't have a budget, a insurance company? You know, people are dying. People are dying because they can't have drugs that we have sitting there right now.
I think that we as a legislature should do everything we possibly can to ensure that life-saving medicines are made available and that doctors have the freedom and the ability to prescribe the medicine that's best for that patient. What we've found is that in many cases oral chemotherapy is the only choice because there is not an intravenous chemotherapy that does the same thing.
This is not another antihypertensive. This is not another antibiotic in which there are a number of different alternatives that one could realistically choose between. In general, in most of oncology, we have one drug at a time. They're very expensive to develop. We don't have a slew of quote-unquote lower-cost competitors. We may have a slew of alternatives that have already been replaced as less effective than what we're currently using as our frontline standard of care agent. And if there were a choice, that would be nice. Many times there isn't. And why should a patient be penalized or have additional stress placed on them at a very important time of their life? That I can't understand.
This report was produced by the Speaker's Office of Member Services.